Hello, Dr. Nick here with Preferred Physical Therapy, where we help people 40 plus stay active and independent, live free from painkillers, and avoid surgery. In today's video, I'm going to talk about the answer to the question I hear a lot from people: when do I need to get an MRI for my low back pain? Just recently, I got off the phone with a lady who said she wanted to wait to start treatment for her low back pain until after she got an MRI. And it was difficult to help her understand why it's not going to be necessary. So I wanted to take a minute and just give you as much evidence as possible as to why it's not necessary. And in fact, only 10% of low back pain cases are necessary to have an MRI. And of those 10% that do need an MRI, what are the symptoms associated with those people who need an MRI? That way, it gives you a much better and more confident understanding of, do you fit in that category, or are you in that 90% group, 90% of low back pain sufferers who don't need an MRI? Because an X-ray or an MRI, neither image tells the whole story. MRIs don't tell any doctor how the pain started. They don't tell us why you have low back pain. When you get an MRI report, you'll see statements on there like degenerative disc disease, degenerative joint disease, facet joint arthropathy, spinal stenosis. You won't know how commonly these conditions are found even in people without low back pain, because a lot of these conditions are age-related changes and are absolutely normal, and are often, almost always actually, even found in people who they call asymptomatic or don't have low back pain. So in order to treat your condition, providers like myself, physical therapists and chiropractors, we need to know how and why your back pain got started. So there was an article written in 2011, and I'll include a link to a blog post that I'm going to put in here, about guidelines for primary care doctors regarding the management of low back pain, and in particular regarding when to adequately require an MRI for the treatment or diagnosis of low back pain. And so one of the more shocking admissions from this study was how often getting an MRI for low back pain led to unnecessary interventions like injections or surgery. So let me read that again. In the study, they admitted to people who get MRIs and didn't need it, people who get it often end up getting interventions like injections or surgery unnecessarily. Means that they didn't ultimately need to get that treatment because they had other options available to them, but because they got an MRI and because there were some findings on there that suggested they might improve from those procedures, ended up getting those procedures when they didn't need them, and they didn't get the outcome that they were looking for. What I'm hoping is that this knowledge gives any of you low back pain sufferers and who may be frightened that surgery is going to be their only option for recovery some additional hope and the patience necessary to look for alternative methods of care that don't include surgery or injections, especially if you feel like an MRI is going to be necessary. And so here's what we found out in that study. We found out there's two types of low back pain, or two types of symptoms in low back pain sufferers that either warrant an MRI or who do not warrant an MRI. And the two types are specific and non-specific low back pain. So specific low back pain sufferers, these are the ones that comprise about 10% of all low back pain and that ultimately need an MRI to rule major factors out, such as if you have a herniated nucleus pulposa, a herniated disc, but more importantly, when you have the inside of that disc that's leaking out into the spinal column. Whether you have infection, whether you have severe osteoporosis, severe rheumatoid arthritis, a fracture, or worst case, a tumor. Now, altogether, all these cases, whether you have any one of those, all those cases only comprise 10% of all low back pain suffering. The other 90% is considered what they call non-specific low back pain. And these are symptoms without a clear or specific cause. What's shocking is, while many people feel like my low back pain is coming from this one spot, it's right here where my low back pain is. And while absolutely respect that that's where you're interpreting where that low back pain is, and that might be where the tissue breakdown actually occurs. It's not always so simple to just go in there and fix that issue, because so often the reason why that area is a problem or that area is broken down is because of other mechanical features above and below that area that contributed to the rapid breakdown of that spot. We see this very, very often in other joints, whether that's contributing to tendonitis in the knees or elbows, whether that's contributing to a more advanced osteoarthritic or arthritic type breakdown in hips, shoulders, knees, big toe. What we're noticing is that there's a high correlation behind tissue breakdown that leads to pain, especially in the low back, that is associated with impairments other places, whether that's poor core strength, whether that's hip joint restrictions. So when the hip's not moving well, we get back pain, and vice versa. We'll have a poor moving hip, or we'll have hip pain that's caused by a poorly moving low back. We see high correlations behind all these things. We'll see back pain caused from hip weakness and hip immobility that's caused from knee restrictions, that's caused from weak feet. We see all kinds of things. Now, MRIs won't show any of that. They might show that there's a hot disc or that there's an irritated joint, or worse yet, we see folks who come back after having an MRI that will show mild degenerative disc disease, mild facet joint arthropathy, and they'll be frustrated at the fact that their report says mild all over it, but their back pain is severe. And that's because we're not getting the full picture. And so what you want to understand is the red flag conditions for this specific low back pain group are if the pain is non-mechanical, meaning that the pain in your back is not related to the time of day or type of activity involved. If it's kind of totally random, unjustified pain. If there's also an included thoracic spine pain, if you have a history of carcinoma or steroid use, like corticosteroid injections, or a history of HIV, if you have a typical feeling of unwell, kind of flu-like symptom, body ache type problems, I call it malaise, those kind of fever, those kinds of things are in that unwell category. If you have unexplained or unexpected weight loss, widespread neurological conditions, structural spinal deformities, or if you're getting back pain younger than 20 or older than 55, that's kind of a smaller or lighter, it's not a hard red condition, but back pain before 20 or over the age of 55 can be problematic. Other considerations for MRI imaging, these are called yellow flag concerns or yellow flag conditions, are the presence of a nerve root dysfunction or nerve root impingement. And these symptoms include any kind of pain that's traveling down one leg, altered sensations or sensitivity in an area that's different than the other limb. If you have pain that goes from your back all the way down to your foot or ankle. Also, if you have a weakness, a muscle impairment, so if you're noticing your foot isn't able to pick up or you feel like weakness causing you to trip over doorways, thresholds, rugs, things like that. The other things that we're saying, it is a better way to describe your non-specific low back pain. Now, this is the 90% of people. Here's what you should do. If you find yourself not in the red flag category or the specific low back pain category that justifies the use of an MRI, the recommended course of treatment is, number one, to get an assessment by a back pain specialist. And these specialists can be chiropractors, they can be physical therapists, these can be spine doctors, orthopedic docs, sometimes primary care, but not often, only because from a specialty standpoint, there's just not enough time in a visit with your primary care doc to go over the kind of objective measurements and tests necessary to identify what's going on. Because what you have to go over is movement habits, restrictions in joints, and a strength assessment through the core. All this information put together better identifies or better encapsulates what is going on with how you're moving and how you're doing that is then justifying the pain you're having in your low back. Next part, and this is where it gets a little bit tricky because it's often very easy to jump to, kind of once we know we have some non-specific low back pain, it's really easy to jump over to YouTube or other online sources to look for exercises for low back pain, because exercise is the number one best treatment for the 90% of people who suffer from non-specific low back pain. Overall, they've looked at everything, and exercise by far is the best treatment for low back pain. It's the one that gives you the most immediate relief and the best long-term relief that does not include injection, surgery, or pain pills. And so it's easy to Google up best exercises for low back pain and to get a whole myriad of those that are beneficial for low back pain. What we see very, very often in our clinic are people who come in and who have tried to do whatever number of exercises or treatments themselves for low back pain and have not had the benefit that they're looking for, or often get worse. And so my plead with these people is to come in and get an assessment to better identify for you, what do you need? What exercise do you need prescribed to you based on what we find in your assessment? And what ends up happening is a lot of folks will be like, oh, I've done this exercise, or I've done that one, or I did this. And it's like, okay, excellent, perfect. We're going to do them together. And as we do them together, we find either they weren't doing them correctly, they weren't doing them completely, or they were doing them for the wrong reason, meaning the wrong dose of how they're supposed to do the exercise to get the benefit that they were needing in order to overcome the issue. One that we often see is an exercise that we call the transverse abdominis draw-in or abdominal bracing exercise. And often they'll do it flexing their abs, kind of like in an isometric crunch, thinking that they're doing it correctly. When the reality is we want to be able to work some pelvic mobility where the spine comes down and sits on the pelvis, work some pelvic mobility to then enhance how much abdominal control we get while we are moving that pelvis, and then incorporate the proper breathing technique to be able to brace abdominally through the musculature, but also through the diaphragm in how we control stabilizing all the innards and guts as we are trying to bend, lift, and twist through our spine. And doing so under supervision gives you a much better benefit or result rather than just trying to do it on your own through the guidance of a video. I know it's extremely frustrating when we have patients who come in hoping to have an MRI adequately diagnose or properly diagnose, and really what they're looking for is justify the pain or discomfort that they're experiencing. It's extremely frustrating to come back and see mild to moderate conditions when they're in such pain, because they feel like it's not justifying the kind of discomfort that they're experiencing, and I totally understand and respect that. My challenge to you is to be patient with getting conservative care, be consistent with the treatment plan set forth for you so that you can better understand what's going to be necessary for you to get better without the need of surgery or injections. Because long term we see surgery is only about 50% of people who improve after surgery, and if you are on a path of injections, you are more likely to result in surgery if you go down the path of injections. So be patient, hang in there, and get the proper care and exercise treatment necessary to get relief. I hope that helps. If you have any further questions, feel free to drop a line or a comment below. Always available to answer some questions. Hope you're well, and we'll hear from you soon.